Hi, I'm James Mundy, co-founder of WearIT, and we want to use real-time data to help people fight addiction. We believe that people can thrive in addiction recovery, not just survive. I choose to focus WearIT on addiction recovery because of the scope of the problem. Right now, there's 23 million people in America that had a problem severe enough to require treatment. That doesn't even include alcohol. That accounts for another 16 million people. Treatment usually consists of a combination of medication and counseling. The counseling-based treatment relies on self-reporting, and unfortunately, accuracy is a problem. People don't necessarily remember or understand when or where they've had cravings in between counseling sessions. We want to help people understand when cravings occur so that we can disrupt the addiction cycle in the moment when it matters the most. WearIT uses wearable biometric sensors, it's like those found in an Apple Watch or a Fitbit, in conjunction with a smartphone to detect cravings in real time. We can then perform a number of actions based on the situation. We can provide an intervention in the moment, like a breathing exercise designed to get their minds off of the craving, or we can provide a prompt to get, like a mobile survey, to get a better sense of their internal psychological state at the time. The goal is to help people understand what's powering their addiction so that they can be better equipped to fight it. We can use the data to discover long-term trends and provide insights into the patient care to anybody involved in the care of the patient, from their individual treatment counselors up to an aggregate view of all patient data in a treatment facility, where it will be uniquely positioned to help treatment facilities use data to prove the efficacy of their programs. We're targeting this at mid to high-end inpatient rehab centers. These are expensive. They cost anywhere from $6,000 a day to, $6,000 for a 30-day stay to $30,000 for a 30-day stay. We'll generate revenue through subscription sales to access the data. A typical center might have an average of 30 patients per month. These are what the numbers look like at $10 per patient per month. Remember, these people are paying $1,000 a day to attend these centers, so that's actually a drop in the bucket in comparison. We would ask that the centers pay for their patients up front for a year in advance to help mitigate the costs or to mitigate attrition due to relapse. And just to give you an idea of the size of the market, there's about 15,000 treatment centers in the US. This is a competition. The main difference is they don't do the context-based or event-based cravings detection. They're more about collecting the data and then acting on it later. And this is our team. Dr. Tim Brick, Dr. Zita Orabex lead the data science team. Tim's background is in machine learning and behavioral science. Zita's background is in psychology of well-being. My background is in mobile application development and delivery. And we passionately believe that people can thrive in addiction recovery, not just survive. Questions?
Do you have any data on efficacy?
We are pursuing an efficacy study with the collegiate recovery communities. We're hoping to do that in the fall. We do have some pilot data using a research-grade device, but we're hoping to get this to test it on actual people in the fall.
And how do you make money?
I'm sorry?
How do you make money?
We would charge subscription access to the data. The numbers that I showed in the slide were at $10 a month. I'm told that that's actually pretty low, but that's where we're starting. We would work directly with rehab centers to use this as something that they can provide as a service to their patients.
So something they would recommend the patient use along with their treatment?
Yeah, it would probably be stronger than a recommendation. They have a lot of control over what their patients do in their programs.
Okay.
Just one question in terms of IP, or how do you, once you have an idea, how do you create barriers of entry to something around this? How easy is that or difficult is that? And if you have any IP?
We don't think that there's anything patentable. It would be, we're working with the Penn State Office of Technology Management on licensing because the development was funded by Penn State. But We think that there's, the barriers to entry would be around the expertise needed to do this and the relationships to develop with the customers, the rehab centers. We have a few that want to work with us on the strength of the Penn State name alone.
Are there any applications here that you've explored in kind of weight loss programs, things like that?
Not weight loss, but there are different applications that we've been looking at. Autism support is one, PTSD is another. Anything where stress is a factor and that stress can be detected.
I mean, if I don't have something salty, I'm feeling very stressed and anxious.
Yeah, or you know, at the moment I'm feeling very stressed, but it's yeah. I mean, there are a lot of applications. Each one would have to be developed specifically. We'd have to run trials to determine, you know, what is a craving for a salty food compared to a craving for an opiate, and that would come out in the data.
Yeah. Just thinking that's a very large market.
I'm sure it is. Yeah.
So just, how does it really work? So when they detect a craving coming on, or when you get, how does that work with the therapist? Do they call their doctor, or you have action items?
So there would be a human component in it. It wouldn't be just detect a craving and let it go. The craving would be detected. We would want to do something immediately for the patient. Like I said, provide a breathing exercise or maybe a survey or something that would help them to get their mind off of the craving, solving that problem. But the bigger problem is, why are the cravings occurring? And a lot of people don't really understand that or know that. So the data would be provided to their treatment specialist so that they can kind of shift the conversation from in their sessions from a vague, tell me what happened last week, to let's look at these specific instances last week and try to figure out what's going on, so that as a professional I can understand your the individual factors that go into what's powering your addiction.
So does the therapist have access to it as well? I mean, is it?
Yes, this would be the immediate, like I said, the immediate access is to the patient because they're wearing it, but it works best when a therapist or a professional would have access to the data.
No more questions? Yep. Okay. Well, thank you very much.
Thank you.